What role does money play in global health ethics? Have you ever thought about how money influences health care around the world? The role of money in global health ethics is both significant and complex. It shapes how health resources are distributed, who benefits from medical advancements, and how we tackle health disparities among different populations. At its core, money affects the availability of healthcare services and funding for medical research. Wealthier nations often have better access to advanced medical technologies and treatments. In contrast, poorer regions struggle with a lack of essential medicines and healthcare infrastructure. This difference raises important ethical questions about fairness and equality in healthcare. Financial mechanisms, like international aid and private investments, determine which health issues get attention and funding. For instance, the global patent system tends to favor research on diseases common in wealthier countries. This focus is driven by the potential for higher financial returns. As a result, diseases that primarily affect poorer populations often remain under-researched. This situation contradicts the ethical principle of beneficence, which emphasizes promoting the well-being of all individuals, especially the most vulnerable. Reforming global health financing is essential to align monetary flows with ethical priorities. One proposal, called the Health Impact Fund, suggests that countries contribute funds based on their wealth. Pharmaceutical companies would then receive rewards based on the global health impact of their medicines while selling them at affordable prices. This approach aims to reduce inequalities by making life-saving treatments more accessible to disadvantaged populations. However, the financial aspects of global health can be unclear. This lack of transparency often excludes less powerful actors, such as poorer nations and marginalized communities, from participating in decision-making. This situation challenges the ethical principle of respect for persons and accountability in health governance. Additionally, the growing involvement of private financial instruments, like pandemic bonds, raises concerns about profit motives influencing health priorities. While money can drive innovation and resource mobilization, it may also create conflicts between commercial interests and the ethical duty to prioritize human life and health equity. Addressing the role of money in global health ethics involves several key actions. First, we must ensure transparency and inclusiveness in financial decision-making processes. This approach respects all stakeholders involved. Second, funding models should prioritize health needs based on ethical assessments rather than market profitability. Third, we need to promote shared global governance frameworks that hold all actors accountable for reducing health inequalities. Lastly, we must balance incentives for innovation with commitments to equitable access to medical advancements. In summary, money plays a powerful role in shaping global health outcomes and ethical considerations. It can either support or hinder the realization of key medical ethics principles. By influencing who receives care, what research is pursued, and how health disparities are addressed, financial factors have a profound impact on global health ethics.